The structural classification of joints is based on the nature of the tissue connecting the bones. The functional classification of joints is based on the degree of movement permitted. Synovial joints are characterized by the presence of a fluid-filled synovial cavity. Ligaments are strong connective tissue structures that connect bone to bone. Tendons are strong connective tissue structures that attach skeletal muscles to bones. Articular cartilage covers the ends of bones in synovial joints and reduces friction during movement. Synovial fluid lubricates the joint and facilitates smooth movement. The shoulder joint is a ball and socket joint that permits movement in many directions. The hip joint is a strong ball and socket joint that supports body weight. The elbow joint is a hinge joint that permits flexion and extension. The knee joint is a hinge-type synovial joint that permits mainly flexion and extension. The joint between the atlas and axis is a pivot joint that permits rotation of the head. The joints between the carpal bones are examples of gliding joints. The joint between the trapezium and first metacarpal is a saddle joint. Movement of the body occurs through the coordinated action of the skeletal and muscular systems. Skeletal muscles are attached to bones by tendons and produce movement by contraction. Bones act as rigid levers, while joints act as fulcrums during movement. The contraction of skeletal muscles produces force that is transmitted to bones through tendons. The coordinated action of bones, joints, and muscles produces locomotion. Calcium ions are essential for normal muscle contraction and bone metabolism. Bone tissue is continuously formed and resorbed throughout life. Bone remodeling helps maintain bone strength and mineral balance. The mineralized matrix makes bone stronger than most other connective tissues. The organic component of bone provides flexibility, while inorganic salts provide hardness. The combination of collagen and mineral salts gives bone both strength and resilience. The arrangement of compact and spongy bone varies according to the function and location of the bone. Long bones have a shaft called the diaphysis and expanded ends called epiphyses. The medullary cavity is present within the shaft of a typical long bone. The outer surface of bone is covered by a connective tissue membrane called the periosteum. The ends of long bones are covered by articular cartilage at synovial joints. The periosteum contains blood vessels, nerves, and cells involved in bone growth and repair. Osteoblasts synthesize and deposit new bone matrix. Osteocytes are mature bone cells that maintain the bone matrix. Osteoclasts are involved in the breakdown and resorption of bone tissue. Bone remodeling depends on the balanced activity of osteoblasts and osteoclasts. The microscopic organization of compact bone allows efficient nourishment of bone cells. Lacunae containing osteocytes are connected by tiny channels called canaliculi. 127. The microscopic organization of compact bone allows efficient nourishment of bone cell.